Now with children, it's a bit different, and I think this is going to surprise some of you parents, but generally these are the same for the two groups, and we would like to see children before they get to age 2. And you may be thinking, well, what can a child do? They can't respond to which is better, 1 or 2. No, they can't. But there are some eye conditions, particularly some serious. There's a pediatric eye cancer called retinoblastoma that the onset is typically around 18 months. And also lazy eyes can affect 2 to 5% of kids, and that really can majorly affect their learning. So these are some things that we really want to see kids early. We definitely want to see them in an exam before they start school, and then as they get into school every year or 2 after that. Okay, one more question. Think of yourself and getting a physical, getting a full health checkup versus a comprehensive eye exam. So how many comprehensive eye exams are performed annually compared to a physical? Is it 3.5 to 1, 2.5 to 1, 1.5 or 1.5 to 1, or is it 1 to 1? Well, actually, it's really close to that, but it's 3.6 times more comprehensive eye exams are performed annually compared to a full health physical. Where did the data come from? Actually, the U.S. Department of Health and Human Services. So there is really an opportunity in an eye exam because it's comprehensive. We do a full history, all the body systems. We check what medications you're taking because some can affect your vision. And we really want to know holistically how the person is doing. So sometimes we think of eye exams as being able to see well. That's a great part of it, but there are other things involved. And as we go through this, we're going to go through the series of tests that are performed or should be performed as part of a comprehensive eye exam. So individuals need eye exams for a lot of reasons. Most people think it's blurry vision. Some of it is eye strain. Some of it is headaches. Those are probably the big 3. After that, we're going to talk about protection from both UV and a new danger called blue light, and we'll talk about that. Some of you may have heard of it. Productivity. Very few people think that, gosh, if my eyes are in focus, I can actually perform better at my job. And eye health and general health. And we'll get into all of these in just a few minutes. We started talking a little bit about kids. Well, let me give you some statistics, especially for those of you who are parents. 25% of children in the United States have an uncorrected vision problem that can impact learning. Now, this might, make it more difficult, challenge them a little bit more. And you think, well, the school, they do screenings. That's going to take care of it. Well, there was a landmark study done a few years ago that combined pediatrician screenings and school nurse screenings. What they did is they had them go to the screening. The results came back. They then took them right in for an eye exam. And what they found was those screenings were only getting it right about 1/4 the time, about 27% of the time. So they missed some things and they over-referred if they didn't really know. So screenings have a place, but they're not a substitute for a full comprehensive eye exam. 80% of kids with learning disabilities, so think of kids that are labeled dyslexic, they've got uncorrected vision problems, and once those are corrected, gee, they don't seem to struggle with learning any longer. Children's eyes are definitely more susceptible to ultraviolet damage. So if you're wearing sunglasses outside because you like the look of them and your eyes are more comfortable, don't be led to believe that your children don't need good UV protecting and blue light protecting sunglasses. 2 of 3 children under age 6 have never had that comprehensive eye exam. And now you know that the standards of care say they probably should. And 80% of learning in the first 12 years is through vision. So we learn because we see. So it's so important that we are in focus for what we are doing, and that implies for kids as well. Let's touch on productivity for a second because there's a couple of studies I'd like to make you aware of. One study that was done found that slight miscorrections, that you've all sat probably behind the big glasses in the eye doctor's office, we call it a phoropter, and when they click and they say, okay, which is better, this one or this one, 1 or 2? And sometimes you say, gosh, there's almost no difference between these 2. So think of having an out of focus condition, and that's how they tested this with just 2 clicks. So it's not one click, which is almost imperceptible, but it's just one more. And what they found was a slight miscorrection in vision, which is not easily perceptible, can decrease productivity by 20%. And for those folks that are in best focus, meaning that they had glasses that were specifically focused for the exact distance that they're working, like on the computer, they were 2.5% more productive. So over the course of a year where you work roughly 200 days, that's a pretty big deal. Also, another study found, and this was done at one of the schools and colleges of optometry, that again, that half a diopter, which is 2 clicks of the dial, it decreased productivity by 8.9%, but this one also showed that people were making mistakes. They were 38% less accurate. So that can impact your performance and your reviews as well. So just think of that when you're thinking of, am I really seeing things at my computer? Because that's what we all live on most of the time, every day. So protection. And obviously, you know, dogs don't wear goggles like this, but this little fellow was tolerant of how it could happen. So what is it about protection that we need to be thinking about? We used to think that ultraviolet light was the real problem, that it was a danger, and it is. It can cause skin cancer. It causes us to get wrinkles. Well, that can happen around your eyes as well, as we'll show you in a few minutes. But that we found was only affecting the front part of the eye. So your cornea, the lens of the eye, but the back of the eye was shielded because it filtered out, the cornea and the lens filtered out ultraviolet light, so it couldn't get through. But what got through was a wavelength, a short wavelength in the visible spectrum, very close to ultraviolet light in the blue spectrum. And you may have read something about this, and that's where we're going to go as we start looking at this. So what are the dangers of UV or ultraviolet light to the eye? Well, studies have already shown that if you're exposed to ultraviolet light without protection, like a brim on a hat or UV protecting sunglasses, you can definitely get cataracts earlier in life. You can also get snow blindness because if you're outdoors, UV is striking from above and it's bouncing off of the snow. If you've ever had snow blindness, and I hope nobody has, you'll never want it again because it's very, very painful. It can also cause some areas to raise up what appear on the white part of the eye, and we'll show you some pictures of that as we go through the eye exam slide. And the lid skin around your eyes is the thinnest in the body, and it's the most susceptible to ultraviolet light, and we can get changes to those lid skin areas and even early eye cancer, and definitely we know UV causes wrinkles. Relative to cataracts, light entering the eye goes through the cornea, then it goes through the pupil, which is nothing more than an opening, and right behind that pupil is the crystalline lens of your eye. It's tiny, it's about the size of an aspirin, but it absorbs all of that ultraviolet light, and it can cause cataracts to form 10, 15, 20 years sooner than they should. So again, a word to the wise is wear good sunglasses when you're outdoors to protect your eyes. Or we can also, when you get new glasses, you can also get what we call photochromic lenses, which actually darken when you go outside, and they also protect from ultraviolet light as well. So what is it about blue light? Have any of you heard of it yet? You might have noticed it by your iPhone screen 2 to 3 years ago. They put in a program where you did one of your updates where the screen all of a sudden got dimmer later at night, like around 7 o'clock. You're thinking, what the heck is causing that? You probably went online to see if something was wrong with your phone, and you found that you can turn that off, and many people did. It's called Nightshade. Well, Nightshade was initiated by Apple because they were concerned of the effects of blue light. Let's talk about where we experience blue light. We can get it from the sun. We can get it from indoor lighting. Our lighting is changing because we're going from incandescent bulbs, which had almost no blue light, to LEDs and compact fluorescents and fluorescents in the tube form that have a lot more blue light. We've got beautiful color TV monitors. We've got our computer monitors, and we have a lot of devices, both phones and tablets, and these all emit blue light. So what's blue light? Well, you can see the visible spectrum that we have here. The visible spectrum is a tiny little slice of all of the wavelengths that were around. Obviously, some of you have been to the dentist and they took x-rays and, you know, they protect the rest of your body because x-rays have short wavelengths and they cause problems. Gamma rays are used to actually, because there's such a high energy, they can actually cut through metals and things. And then we've got ultraviolet, which we know is dangerous, and then the visible spectrum. The harmful blue light is between 380 and 500. Now, not all of it is damaging. Then you get the infrared, microwaves, radio waves. They're not harming anyone. So it's this little slice of blue light that we have to take a look at and be concerned about. We get the majority of exposure, our eyes do, from the sun. It's hundreds of times more powerful than any of the devices or the indoor lighting that we have. But think of it, we've been outdoors for a lot of years as humans, and we really didn't see much going on from that particular area or particular problem. But now we've got this extra exposure with all of the devices and the indoor lighting. There is a concern. You can see all of the devices that are out there, and they all tend to peak at about 455 nanometers. It's just a measurement of the wavelength that's there. So we've got to look at that and say, would blocking that wavelength be valuable, and can we do it? Well, we'll show you in a second that we can. There's three concerns about blue light, and I'll go over them fairly quickly. First of all, it can definitely cause digital eye strain. People wonder why they look at a computer and their eyes start to get tired at the end of the day. In fact, 70% of adults who report regular usage, they've got some of this digital eye strain. And you can see on the upper image that the blue light focuses just a little bit in front of the retina, the red a little bit behind, and green is pretty much spot on. So if we're trying to look at a screen and there's a lot of blue light images there, our eyes are not quite in focus, and so we strain a little bit, and that can be problematic. The second thing is, and this may relate to you and your children, is sleep disruption, circadian rhythm disruption. So blue light basically stimulates a part of our brain, the pineal gland, and it says, hey, there is no reason to secrete melatonin, which makes us drowsy and sleepy and kind of sets our clock to go to bedtime. And if we've got that stimulation of blue light, so if we're on a tablet or our phone laying in bed up until the time we go to bed, sometimes we close our eyes and we're really not sleepy. Maybe your kids say the same thing. They're really not. So those are some things to be considerate of. Probably cut down on the exposure for maybe an hour or two prior to bedtime, and you'll find that your sleep patterns go back to normal. The biggest concern that we have is scientists have discovered, and as you can see, the upper image shows that UV is blocked by the crystalline lens in the cornea, but the blue light goes all the way back to the back of the eye. What scientists noticed a few years ago is that eyes that are more exposed to blue light show more of a substance, and you look down at the bottom, called lipofusin. Lipofusin is what we have determined to be an aging pigment. It shows up in our eyes as we've gone through a full cycle of life, let's say in our 70s and 80s, sometimes 60s. But what they noticed was if we've got a preponderance of blue light entering, we are seeing more of this lipofusin in the retina. That indicates that that retina is aging prematurely. And there's a concern because this is the same retina that shows early macular degeneration. Now, there hasn't been no study yet that correlates completely that blue light causes macular degeneration. But if you think of it, and it causes the same changes in that deep part of the retina, we've got to be concerned long term. So the word to the wise is we need to be concerned about it. We need to understand it a little bit better. There's studies ongoing right now to really nail it down. Good news is we do have an internal protection. If you look at the image on the right, we've got this yellowing area. That's a protective pigment that's naturally in our retinas. Unfortunately, with people who have macular degeneration in their family, or as we get older, this pigment lessens, and so less of the blue light is blocked or absorbed, and more of it can get back to the retina. setting off this free radical change and damage to their photoreceptors via some of the deposits of lipofusin. Now, can we protect it with glasses? We can. There are a number of anti-reflective coatings that are perfectly clear that go onto lenses that block 20 to 30% of the blue light at that peak, that 455 nanometers, coming off of a computer or a device. Most people want their glasses to look nice and they want them to be clear. We can block 100% of the harmful blue light, the 455 nanometers, with the Blue Tech lens that you see there, but you notice that it also looks a little yellowish brown. Most people are not comfortable. They don't like the look of it by walking around with it. Some are fine with it, but many aren't. So many of them are getting, if they work a lot on computers, they're using the Blue Tech lens as protection while they're on the computer, and then they have their regular clear pair with the anti-reflective coatings that still block some, but not 100%. So I bring this up because it is relatively new news. I would encourage you to read, if you see an article about it, continue to learn about it. And as time goes on and we get more information, hopefully we can come back and give you an update at some point in the future. So let's turn our attention to the eye exam. What are the service elements of an eye exam? And we're going to go through each of these. I think you'll be able to relate to these of the eye exam that you've gone through. But all of these need to be completed as part of the comprehensive eye exam. Good news is, with the iMed benefit, all of these are required of our doctors to do. A comprehensive eye exam is our standard of care. Not all vision plans follow this guideline. Some of them make up their own, and we don't find a reason to do that. My quality assurance committee says, hey, there's a standard out there. Let's just go ahead and follow it. All right, so let's start. Visual acuity. It's pretty simple. Basically, you read the smallest letters you can with each eye, both with and without your glasses. And this gives us a good idea of how well you're seeing. Are your current glasses up to speed with what they should be? But honestly, most people think of the visual acuity test. That's the screening that kids take at school. Honestly, we gave you the 27% figure before. If you only use visual acuity or an eye chart, you really only get it right 5% of the time. So it's not a full eye exam in any way, shape, or form. And like I say, it doesn't even meet the 27% of doing other tests in the screening. The next one, visual field screening. Now, this is a test that is typically done by a technician prior to you seeing the doctor. If you remember, you cover one eye, you put your head in an instrument, and it looks like a big white salad bowl, if you will, and you're given a clicker. When little lights pop up in that sphere that you see, you simply click the button. And I know sometimes people feel like they didn't do well with it because they weren't sure if they saw it or not. And again, part of the reason that we do this is to see if you have both peripheral and central vision, and that you have it in all quadrants, that you're not missing something in a given area. If we have misses in these areas, it could be something, you know, that it's hard for you to perceive, but this is one of the tests that does point out if we're losing some vision in the periphery to glaucoma. And if we get a big area that's missing where a person didn't see it at all, this could be indicative of a mass or a brain tumor that's pressing on the nerve fibers that allow the signal to go from your retina in your eye all the way to the back of your head in your brain. So visual field screening is a very, very important test. If we get failure on a visual field screening, we will often schedule a more intensive visual field test to really nail down the exact size, shape, and density of that field loss. So it's a really important test. I know it's not necessarily the one that you feel most comfortable with, but it's definitely an important test. We always look at that area around the eyes. We said earlier, ultraviolet light can cause some problems. Now, the image A on the left side at the top, that's simply a cyst. It's nothing more than a little fluid-filled space. People don't like the looks of them. So oftentimes we will send this off as a referral to an oculoplastic surgeon, an eye doctor that specializes in plastic surgery, and they carefully removed this so there's no telltale that it ever existed. So that's good. Now, B, it looks like that eye is fairly normal, but in that same area of the lower lid, notice that there is a little black spot. And I think I've got my arrow here. You can see it right there. That's actually a beginning tumor of the eyelid or cancer. So we need to make sure that we see these, spot them early. The good news is most eyelid cancers are very, very slow growing, but we do need to address them because, again, they can spread and they can progress. So we've got to protect the eyelid skin and the eye itself from any changes there. Now, the images to the right, I know some of them are a little unsettling with it looks like fiery red and things, but this is actually exposure to ultraviolet light without protection. So the one on the right is what we call a pinguecula. Now, some of you may have noticed that your own white part of your eye looks like there's just this little thing there. Think of it more like a thickening of tissue or like a callus, because the eye is protecting itself because of this overexposure. And if a pinguecula, as you see here, gets a little bit irritated, it can turn into what you see on the left side called a pterygium. This is where that area becomes quite upset. It's inflamed and it starts to actually grow onto the cornea. We see this a lot. I do some humanitarian missions where we'll travel to third world countries that don't generally have access to eye care. And we see this in a large number of individuals. I was in Mexico, outside of Mexico City, about 2 hours. And people were being bussed in 5 to 6 hours away. And we saw over 20% of the males had these because they're outdoors all day and they don't have any protection. So we were giving them non-prescription sunglasses, but at least we could get them some protection. Eye muscles. We're going to talk a lot about eye muscles related to your work, especially on the computer in just a second. But eye muscles are important because we have 6 of the muscles around the eye, and we want the eyes to move very smoothly side to side. So you may have wondered, why is the doctor moving this light in front of my eyes and moving it in all these different directions? We just want to make sure that the eyes are moving freely and that there isn't any deviation at some point. So the images on the left, the ones with the little blue eyes, that was very, very normal. They move to the right, they move to the left, they go up, they go down, they do fine. Look in the black and white images on the right and notice the center image that we see right here. Notice this person's left eye in the natural straight ahead gaze is turning upward. And so again, this person, when they're looking straight ahead, they're either seeing double, we call it diplopia, or this left eye is suppressing. So again, these are things that we need to take a look at. Our bodies can kind of take over and the brain will turn this eye off if it is seeing double in many cases because they don't want the person to be disoriented. But that can be problematic long-term relative to a lazy eye. So we definitely need to take a look and check for any abnormalities in the extraocular muscle movement. Now, you may wonder, why did the doctor have me put my chin in a chin rest and have this fairly bright light looking in my eye? The slit lamp is nothing more than a microscope. It magnifies the eye 6 to 35 times, and it allows us to see fine detail of actually the entire eye. Mostly the front part of the eye is easy. We can see the cornea, the outside of the eye. Now, if you look at the image on the right side, you'll notice that it looks kind of yellow. That's actually the crystalline lens of that person's eye. And the reason it's yellow is that eye is forming a cataract. The inner part of the eye, the lens, after it's exposed to a lot of elements, UV being one of them, as we go through life, it eventually starts to get yellow and cloudy. And that's where we can actually view the degree of cloudiness is with a biomicroscope or a slit lamp. So we get to see all of these structures very nicely. By using a special lens, we can get a real good magnification of the posterior part of the eye, which we'll show you in a second. Now, eye pressure testing. eye pressure testing is important for glaucoma. Glaucoma, one of the risk factors is high intraocular pressure, and truthfully, it's one of the few areas that we can test and measure how a person's eye is doing relative to treatment if we believe they have glaucoma due from our diagnostic test. The test that probably most people say, if I could avoid it, I would be the puff of air test, which is the one on the left side. So that is a screening for intraocular pressure. There are other methods. The other two that you see on the right are other methods of testing intraocular pressure. They involve a very, very light touch to the very front of the eye. When we do that, we put a drop in the eye to numb the eye or make it not feel that slight touch that we have. But all of these are methods to check intraocular pressure. It's especially important as we get over age 40. And we'll give you some statistics in a second as to the numbers of people that do have glaucoma and why we need to test for it because of its lack of symptoms. Now, one of the most important tests that we do is to view the inner eye. We need to look through all of the eye structures to be able to view the back of the eye. Now, in some cases, as we get older, our pupils tend to get smaller and smaller. It actually helps us focus better, but it also makes it more and more difficult to see those structures in the back of the eye. I'm going to give you a bigger view of that image on the bottom left in just a second, but suffice it to say, it's important that we do that test. I know the other test that people don't like is when we put the drops in your eye to dilate the eye, but it's really the only way we can see the back of the eye. There are new instruments that we can use to photograph the inner eye even without dilating, which is a great idea, but it doesn't give us every view that we need, so it still is important to get your eyes dilated. Finally, we always take a look at the iris and especially how your pupils react. We said that pupils do get smaller and smaller as we go through life, but it's important to understand that the pupils should be equal in size. So if you look at yourself in a mirror, you can probably look at your right eye, your left eye, and the pupils look about the same size. They should. And they should also react very equally when we shine a light into one eye, the other eye should close down. So the gentleman that you see on the upper picture, his right eye didn't get a dilating drop and the left eye didn't. This is an individual that has an abnormal pupil. Now, abnormal pupils could be as simple as, well, the muscle that constricts the pupil is just lazy. That does happen, but it also could be as serious as a brain tumor. The pupil is kind of a nerve center for many of the cranial nerves, and it can signal us when we have something going on in the cranium. So again, pupil reaction is just super important to test for. Now, the refraction. Everybody thinks that this is the eye exam because this is where everybody focuses, because I want my glasses or contacts to be right. I want to see really well to look far away or up close, those particular areas. And actually, all of the tests that we've done up to now are about 80% of the eye exam. The refraction or getting the prescription right is only 20%. So again, it's an important part. It definitely adds back to that productivity part that we talked earlier, but a refraction is really just to gather your prescription. So how can an eye exam keep you healthy? All right, let's take a look at eye diseases. We've already talked about some of these, but I want to give you some statistics so you understand the importance of getting your eyes tested. I can't stress it enough about glaucoma. Glaucoma has sometimes been labeled the silent thief of sight. Why? Because it has no symptoms in the early stages. It does not blur your vision, and you do not feel pressure in your eye. Some of you are thinking, yeah, but I wake up in the morning and one of my eyes is just, it feels like there's pressure behind it. That's truthfully sinus problems. It's not glaucoma. Glaucoma basically is an age-related disease for the most part. Usually we don't see it until age 40 or beyond, but having no symptoms, if we don't test for it and look at the eye pressure, look at the characteristics of the inner eye that are clues and risk factors for glaucoma, we will never catch it early enough. And what it does is it gradually takes away your vision in the periphery. So think of the vision kind of lost in the periphery, and it closes in and closes in. People do notice it when it's very far advanced, but then there's not as much you can do with it. It's like having tunnel vision. You can't see to the side without actually turning your head or turning your eye. It's not rampant. We only have 2.2 million Americans 40 years of age and over that have it and are being treated for it. Sadly, there's another 2.2 million that have it, but either don't know it, or because they don't get instant gratification from the eye drops that lower the pressure, they stop. It's projected that this is going to go up by 2050 to over 7 million because of people that are in my age group, the baby boomers. So it is very important to get a comprehensive eye exam. There's always testing done for glaucoma. Now, we've talked a little bit about cataracts, that UV can cause early cataracts. Bottom line is, it's an aging process that our bodies go through, and everybody on the call is going to get a cataract if you live long enough. Now, whether you decide that it's causing enough blur to have cataract surgery, that's up to you, but it is just a part of going through life. There's nothing we can do. Now, there's actually good news about cataracts. Cataract surgery in the United States, the technology is so advanced that it's a 10-minute procedure, and it actually allows you to pick your prescription after cataract surgery because they take that cloudy lens out of the eye very simply and easily through a very, very tiny incision in the front part of the eye, and they replace it with a clear artificial lens, and you get to pick your prescription because we can adjust the power of that lens to zero in on the focus that you want. So it really is kind of a refractive procedure, meaning it can change your prescription in addition to making your life clearer and easier to see. Now, diabetes, we're going to spend a little bit of time on it in a minute, but diabetic retinopathy is a serious complication of diabetes. Diabetes really, when blood sugar rises, it causes the tiniest vessels in our body, the capillaries, to become inefficient and actually leak. And when that happens, it causes problems in 3 major areas of the body. There are others that have minor problems, but the eye is a major area of problem. People can lose vision, which we'll go over in a minute. It affects kidneys, their function, and so many advanced diabetes patients are on kidney dialysis. And it also affects your extremities, the end of the line, your toes and your fingers, and they lose circulation, and this can be very problematic for people. So if you take a look at diabetic retinopathy, the second bullet says it results in vision loss and blindness in 40% of patients with diabetes. I'm sure all of you know someone with diabetes. It's almost impossible not to today because we have over 30 million people, 13% of our population with diabetes today, and it's getting worse. The third bullet says we have an increase of 89% of diabetics that have this retinopathy since 2000. So that 40% is going to creep upward when they report the next time. So it is something that's important, and I'm going to stress it does not impact the vision in the early stages, and sometimes even the advanced stages until it's basically lights out where you just lose your vision. Finally, macular degeneration. We talked about macular degeneration early, related potentially to blue light exposure, but macular degeneration is a true degeneration. It causes us to lose our central vision. The macula is our finest form and color vision. So when you're looking right at this screen, if you're looking at my pointer that's right there, you're using your macula. If we lose our macula, we lose essentially almost every detail of vision that we like. So you can see in that picture off to the right side, a person with moderate to severe macular degeneration can see to move. They can see in the periphery, but they can't see straight ahead. So you can't read. Television's not interesting because you can't see the central part of the screen. Obviously, you can't drive. You can't even see the screen on your cell phone. So macular degeneration is serious, and we need to be cognizant of it because it can affect our life in a very negative way. Now, smoking, you're 3 times more likely to have macular degeneration. If it's in your family history, you're more likely. So we really need to be vigilant about it. Another good reason to get an eye exam, because there are some things that can be done to push back or forestall the advance of macular degeneration if we catch it early. So I would urge you to get your eyes examined, if nothing else, to make sure that your eyes look healthy in the back and everything is looking well. So let's talk about chronic disease, because these can affect your health. We already said 32 million Americans, or 13% of the population, age 20 and over, have diabetes. Unfortunately, almost 10 million is undiagnosed because most of this is type 2 diabetes. I'm going to give you a little quiz. It's nothing that's going to be on the test, so don't worry about it, but I do want to ask a question because most people have heard that there are type 1 diabetes and type 2 diabetes. So think to yourself and think, gosh, which is more prevalent in the US? And most people do get this one right. It's type 2 diabetes. What is the percentage of type 2 diabetes to type 1 diabetes? And most people are astounded that today it's 92% type 2 diabetes, 8% type 1. By 2020, just in a couple of years, it's supposed to be 95-5. Type 1 diabetes is caused by individuals who have a pancreas that's defective. It doesn't make insulin, so it can't counterbalance any glucose that we take into our body or sugars. Type 2 diabetes is basically the pancreas works, but because of many factors caused by obesity and other factors, the insulin can't work. And so our bodies still are overloaded with glucose, and it really causes problems. We also have a very scary situation where we have 86 million individuals that are labeled pre-diabetic, meaning their blood sugar is a little elevated, or they have a body mass index of overweight or obese. And in a study that was done a few years ago, trained nurses that do disease management, trying to help these individuals manage their diabetes better, they found that 90% of them are in denial that they will ever have one of those three body problems: retina or eye, kidney, or extremities. They say, no, I know I've always been a little bit overweight, but I can manage it. I can lose weight anytime I want to. The problem is that they don't. So, and you can see hypertension and high cholesterol. Most type 2 diabetes patients are on medication for all three of these for obvious reasons. So eye exams are really important. I've listed a number of the things that we find in a comprehensive eye exam. It's not that that's our main focus, but as we go through the series of tests, we can find all of these things, including diabetes, high blood pressure, high cholesterol, arthritis, hardening of the arteries, MS, so all of these, and I could give you 30 or 40 more that we can find. It's not that that's the reason that the person came in for the eye exam, but it is something that we identify as a part of the exam. So what is it that allows us to find so many of these interesting things and maybe be able to help people? Well, it's blood vessels. This is that same picture that was pretty small in the first one, but notice that we have blood vessels. Every time we do an eye exam, we get to look at the back of the eye. We get to see arteries and veins. I've pointed out the macula. Notice how it looks nice and dark brown. That's the supportive pigment that supports the cones that we need to be able to see our finest form and color vision. The optic nerve is nothing more than a collection point where we can have all of the receptor cells funnel into and go back to the brain. But these are big vessels. I mentioned earlier that diabetes attacks the capillaries, the tiniest vessels in our body, and actually once blood sugar goes up, it causes them to leak. So sometimes we're looking at an eye, the person comes in, they say, you know, doc, my prescription's changed a little bit, or I need an update in my contact lens prescription. What can we do? And I'm like, well, let's take a look in the back of your eye and just see how it looks. And instead of the view that we have here, what we see is all of these little red dots. I'll point out one right here. Those are basically hemorrhages. One little drop of blood leaked out because that capillary underneath the retina, a whole network of capillaries exists underneath the retina, it leaked. This is early diabetic retinopathy. The more sophisticated term that we use is mild non-proliferative, so this is the earliest stage. But this person has diabetes, not pre-diabetes, this is diabetes. So this is how we find diabetes in the eye. And again, our job now is to get this person to an endocrinologist or internist that can help them lower their blood sugar. And these will go away in months if they can control their blood sugar, either through an oral medication where they start, plus diet and exercise. This can really be good. And if they don't, in as little as 2 to 3 years, we can get in a bad situation. This is what we see when a person's blood pressure is out of control. To give you an idea, this person's blood pressure is 200 over 120. Now, most of you know that you should have blood pressure under 120 over 80. So this person's is severe. And you can see that it's a little cleaner looking than some of the diabetes because there's not as many hemorrhages, but they're bigger. And these white areas are areas of swelling that we get from the pressure. So again, sometimes you find these more and more eye doctors, and maybe your eye doctor is, as a part of their routine, is taking blood pressure. And I think we'll see this to be pretty standard and routine. Now, you've seen a couple images. The upper left is basically a shadow, so it's not the best picture. But I'm going to point out a little white spot that some of you may have already identified right around the optic disc. It's right there. That's a cholesterol plaque. And it happened to lodge there in this vessel coincident to our eye exam. And we could observe it. Now, this isn't something you see every day. When you saw that early diabetes, some of my colleagues who are doing clinical care regularly now say that, people coming in for a routine exam in their vision plan, sometimes 20 to 30 times a month, they will see these individuals. That's how we're starting to see these type of increases. Now, I saw 3 of these images as you're looking at it now for high cholesterol in my career. But this is potentially life-threatening because if that plaque dislodges from its position there, it's going to probably find a resting place in a vessel in the brain, and that's what causes a stroke. So again, I'm not saying that this is what our goal is when we set out to do the eye exam, but when a person comes in to present themselves thinking that they need new glasses or they have a headache, sometimes we find things that can be life-altering from that perspective. There's one other way that we pick up high cholesterol, and this is unique. You may have noticed a ring around the outer part of the eye in some of your elderly friends and relatives, and think 70s and 80s. Or I've had more people tell me, you know where I've seen this? In my dog that was 18 years old, very old. And these are normal at that age, but this is 80% correlative for high lipids, triglycerides, and cholesterol, but it's only in males 30 years of age and younger. So think of their heredity. So genetic predisposition, their father, their grandfather on their father's side probably had these problems. So again, we get a referral in and they get them on anti-cholesterol medication, and hopefully they live a normal and healthy life. But sometimes you find things that you didn't expect. So let's go through quickly how you can be better, especially if you're working on a computer, because that's what people ask. So computers, you're going to be doing near tasks. Now, the interesting thing is, if you actually measure where you read, most people will hold a book or a newspaper, depending upon how tall you are, around 16 to 18 inches away. Computer screens, if you were actually to just sit where you're most comfortable in the morning and have someone measure from the bridge of your nose to the computer screen, you'll find that you're about 20 to 24 inches away. Those two distances don't necessarily coincide for a glasses prescription, especially if you're over 40. Also, your eyes need to turn inward to look at the computer screen. And you've got to blink. Now, we normally blink, and there's quite a variance, about 14 blinks per minute, but it could go up or down by 10. But we do know that if we measure a normal blink rate for a person, and we put them on a near task like reading or a computer, it automatically goes down on average 4 to 5 blinks per minute. So if you wonder why your eyes feel drier at the end of the day, you gotta think blink. So if you're feeling dry, just as you're going through your day, just think, oh, I got to blink a few more times, and you'd be surprised how much more comfortable your eyes can be. We talked before about convergence. Well, if you're looking at a close object, so look at the bottom right image. When we're looking straight ahead, eyes are pointed straight ahead. But when you look at a near object, your eyes have to naturally turn inward. If you don't, you can't see it clearly, and you might even see it in a double manner. You see the image on the left is an eye with the different muscles. There are 6 muscles around the eye. The one in the middle on the right, the medial rectus, is the one that has to work to turn our eyes in. Now, the good news is it's the biggest and strongest muscle of the 6 eye muscles because it was built that way. That's because we have to use our eyes for reading. That muscle has to interact, and then it has to look far away again. So again, these are some things that we don't often realize when we have to look up close. Now, our eyes also have to do what we call accommodate or accommodation. And accommodation is easy when we're younger because this lens of the eye, you see the muscle and you see that lens right up here. This lens, when it's in its thin form, allows us to see far away. And when we bring something up close to read, this muscle contracts inward and releases the fibrils, and it allows the lens to thicken. That's what allows us to see up close. If for those of you on the phone who are late in your 30s or already into your 40s, you've probably noticed that your eyes are beginning to change. You can't read as close to you as you used to, and in fact, you're probably pushing things back a little bit or seeking more light to be able to see. This is called presbyopia, and there's nothing you can do to alter it. It's just going to happen. So again, you can use reading glasses, you can do all sorts of things to allow yourself to see up close, but that's something that you have to do to focus on the computer screen or your near tasks at work. Now, we talked about blinking. Blinking is important because it spreads the tears evenly over the front surface of our eye. The image on the right side here, notice how we get these dark images. This is called tear breakup. If we don't blink for a period of time, and remember our blink rate slows down as we're looking up close, we will get these dark areas showing, and that's basically exposing the corneal tissue to dryness. And it makes us blink. And if we don't get enough, the lower image that you see here shows that we have actual dry, desiccated areas. This is damage to the cornea because it's not getting enough moisture, and maybe the person isn't getting their lids closed when they blink every time, or not even closed completely while they sleep at night. So these are factors that can impact your work on a computer. And headaches. Headaches can occur from one or more causes. It could be an uncorrected refractive error. The more common ones are farsightedness, uncorrected astigmatism. If we have problems with our eyes turning inward or accommodating, that's a factor. Could be sinus. We already said that's a factor. And it could be as serious as a tumor. So all of these are things to think about that we can help you sort through during a comprehensive eye exam. So to wrap this up, I'm going to go through a list of things, and then we've got a couple minutes. If you guys, I know you can type in a question, so be thinking of one that you would like to do. We do have a couple of minutes left that we can answer a few questions. So first of all, make sure that you get regular eye exams. If you have already signed up for the iMed benefit, please use it. We want you to use it. We want you to get your eyes examined so you can be comfortable, in focus, and we know that you're healthy. If you're wearing contact lenses, and I know that we probably have many contact lens wearers, national average is about 21 to 22% of people that have corrections with contact lenses, please replace your lenses as prescribed. If it's a 2-week lens, please don't make it a 1-month lens. It wasn't designed for that. And I know it's less costly if you stretch that out, but it also can cause some pretty serious eye health problems if you don't replace them on time. So just a word to the wise, replace them on time. Make sure that your eyeglasses have protection for ultraviolet. If you've got polycarbonate lenses, they block 100%. If you've got transition or photochromic lenses, they block 100%. And also be thinking about that high energy visible or blue light. That's important. If your everyday glasses are not ideal for your concentrated work task, especially the computer, talk to your doctor about getting a work pair. And again, think of it, if you're working on the computer, maybe you want to think of those blue tech lenses to protect against that added blue light that you're getting. Good nutrition. A lot of things start with just basics, and good nutrition is important. I can't stress enough that green leafy vegetables are some of the things that we really need for our eye health, particularly macular degeneration, which we're going to cover in one more supplement that we'll talk about here. If your eyes are getting dry, particularly stay hydrated, drink adequate fluids. Men need a little bit more fluids than women, but about 13 cups to 9 cups. So if you think, oh, I probably drink that every day, you probably aren't even getting half of that. So try to make sure that you're drinking, some good fluids and staying hydrated. Think blink. We've already talked about it. If your eyes do get dry or you're getting inconsistent vision, sometimes that's because those tears break up, and if you blink and it's clear, that's actually what's happening. If your eyes feel dry at work, there are some great quality artificial tears out there. I am not talking about Visine and Clear Eyes. Those are actually decongestants. Some of them contain antihistamines, which actually in the long run dry your eye out. So really make sure you look for a quality artificial tear. You shouldn't need to use it more than 3 or 4 times a day, but some people in a drier environment and on the computer can really have that. Also, consider nutritional supplements. Lutein and zeaxanthine are present in kale and spinach and green leafy vegetables, and these are important for your macular health. These are the supplements that people take when they do show early signs of macular degeneration, and we want to see if we can stabilize it. Also, a quality omega-3 fish oil with high levels of EPA and DHA can also help in all of this with your eye because it reduces inflammation throughout your body, and it also helps secrete the oils that make up part of your tear layer, so these are important. So with that, I'm going to open it up. If somebody has a question, I know Rachel just posted that. I'll try to take a couple of questions and we'll go through those if anybody has any. Thanks, guys. We've had great attendance and it's been consistent. So I don't think I scared anybody away. I know a couple of the pictures were not the most pleasant to take a look at from that perspective. So, all right. Well, so far, Rachel, we haven't had any questions pop up. Amy says, I'm terrified now, but she said thanks. So I appreciate that. Usually the most common thing after one of my talks is people say, I know what I'm going to do. I'm going to schedule my eye exam. And I hope all of you that haven't had an eye exam this year will pick up the phone and find an eye doctor and make sure that you get your eyes examined. That is really important. Okay, so here's one. I had LASIK surgery last year. Do I still need an eye exam? This is a great question because once people think that their refractive error is corrected so that they can see well far away, it's like, well, I don't need to go back in because I'm done. Remember, the eye exam is holistic. 80% is about your muscle balance, eye health, pupil reaction, everything involved. 20% is about refraction. So the answer to that one is definitely yes. You do need to make sure that you're getting your eyes examined. Jay says, yeah, I've already got an eye exam scheduled this week. Kudos, Jay. That's awesome. So let's just jump to the next slide. And I really want to make sure that you can get your incentive for taking the course. I hope it's been valuable, but really make sure that you go in and take the exam and get it done, get a 75 and get it done by August 9th so that you can make sure that you get your incentives for taking this course. So I appreciate everybody's attendance today. This has been an awesome experience for me. I hope it's been the same way for you. So at any rate, have a great day. And Rachel, thanks for inviting me. And hopefully as things change, maybe we can come back and do it again sometime.
Sure. Thank you very much.
Bye-bye now.